Hi, Mark and Sharon from Physical Therapy. Today, I want to go over a common problem that a lot of people have, and that's shoulder pain with the possible cause of shoulder impingement. Shoulder impingement is a name that gets thrown around a lot when somebody elevates their arm and they get a type of pinching type pain. So, because that is so common, we're going to give you a couple ways to kind of screen for either having it potentially or having the opportunity to get it, which is ideally not what you want. So what you need to keep in mind, shoulder impingement simply means that when you've got the arm where it attaches into the joint up here, so if you think of your upper arm like a golf ball and the other end of that joint on the shoulder blade like a golf tee, it sits in there. So when you go to elevate your arm, there's a lot of different structures between those two areas, and they can get pinched if your mechanics are incorrect, if you've got tightnesses somewhere, if your posture is not good, or if your shoulder blade isn't moving like it's supposed to. So there's a number of causes why you can get that. But typical symptoms for that are going to be just pain as you start elevating your arm, and it's usually going to be somewhere in this area here. So what we're going to do is give you a couple of quick, easy tests that you can use at home to kind of see if you are having the problem, or if you may be having the problem, or if you need to get it checked further. So the first test we're going to use is Sharon's just going to take her left hand and put it on her right shoulder. And then from there, all she's going to do is raise her elbow. And you can see how she brought that up. So pain with raising that could be a possible sign of impingement. Okay? Second test we're going to do is called the pencil test. Okay, I'm going to use 2 sticks, but what Sharon's going to do is just hold them in the palm of her hand and let them come out between her forefinger and thumb. Stand in normal posture. She's going to look down at the sticks and see where they're pointed. Her sticks are pointed in. What that means is that her shoulder can be rotated inward, which is a position that you don't want to be in because that can cause problems with the shoulder. So ideally, when you look down, the sticks will be pointed forward. So you can look at that and see where do you normally stand. If you find that they're pointed in, you want to start self-correcting and work on rotating those shoulders back. The third test is going to be a range of motion test, and this can also be a clue as to whether you're getting very stiff and maybe losing some of your shoulder mobility. So we're going to have Sharon turn back, and all she's going to do is she's going to take her left hand up behind her back, or over her head then, and her right hand behind her back, and all she's going to do without throwing it back there or without walking it up, she's just going to see how close she gets these. Ideally, somewhere between a fist or closer is what you're looking for, so we can see she's got a little bit of a limitation there. Then you do it on the other side, so the right hand would go over and the left hand up and compare. And sometimes you'll see a big difference from one side to the other too, which means then that should be worked on and you might be losing some mobility. So those are all screens, thank you Sharon, those are all screens then that a person can do to kind of see if maybe they have a little bit of a problem or maybe the start of a problem. If you have further questions, contact us at physicaleversville.com.